Thanks very much for joining us. What's the motion about, and why is it needed?
Okay, so it's very much about in the situation as we find it in Portsmouth now. So the Nuffield Trust has found that Portsmouth has the lowest number of GPs per person population in the country, and it's fallen from second worst to the worst. So previously Hull was the worst in the country, and now we are. And so it's based on that in terms of that recent evidence, but it's also based on the background to it is very much based on experiences I and other campaigns for Lib Dems have had during the election campaign that we had earlier this year. But also, and in my professional area of work, I work in the adult social care sector, and the feedback that we've had from some of our clients and carers within that area has very much been about this situation with having real issues accessing GPs, and being able to have the support from their GPs that they feel they need. But that all obviously fits in with the fact that we now know we've got this statistical thing that we have the lowest number of GPs per head of population in the entire country, which is just a real problem. And so the whole motion is about recognising that fact. What can we do with GPs and other primary care? Because let's not forget, primary care is not just GPs; it's pharmacists, physiotherapists, and other healthcare professionals as well, who are there to support you as your initial contact with the healthcare system. And how can we work with them to improve things in terms of access to GPs and primary care in general, but also what can we do about helping GPs be recruited, and indeed can we actually recruit them and employ them ourselves?
How is it that you think the council is going to have more success than existing practices are with regard to that? What could the council bring to bear that perhaps hasn't worked elsewhere?
It's GPs are a really tricky one. I mean, the GP model, the model for GPs being employed and indeed having their own practices goes back to 1948. It's pretty much unchanged since then. And it is very difficult for third parties to employ GPs, which is one of the issues. So therefore, you can't. So perhaps if you just want to set up a practice, it's virtually impossible, or it's very, very difficult. And indeed, the way that it works, and we had this when we had the motion 2.5 years ago, which is during research for that motion, it was found out effectively we're all owned by our GPs. It's that they own their list, and to set up a new practice, they have effectively you have to get a GP or GPs to relinquish part of their list, and that has a financial impact on them, because if you have less people on your list, it has some impact on your funding, etc. So it's a difficult thing, but also within GP practices, one of the issues is you have to have partners. So in terms of if it's a traditional setup GP practice, you have to have partners. So that means you have to have a core group of GPs who effectively are the owners of the business. So GPs might fundamentally be independent contractors, but most of them, especially now, they club together to create practices together, and they own that business. But they're responsible for everything. They're responsible for the building. They're responsible for all of those aspects. There's a huge amount of paperwork. It's much more than it used to be, and therefore it's a huge bureaucratic burden. And one of the issues why we've had the mergers of practices around the city over the last few years is very much because you've had people who've retired from becoming partners, or people who just don't want to be partners anymore. So they move on and they just want to be a salaried GP. So it's that salary GP bits that, if the council was able to, would be really helpful, because what you could do is you could employ GPs who could perhaps be support other practices around the city, or you could help a practice out by employing them directly. There's a lot of legal stuff, because of course to be able to employ GPs, you need to have that funding stream to get that, which in the same way, so effectively you need to take some NHS money to employ the GPs. And that's quite a bureaucratic process. So one of the things we're really asking about in the letter to that the leader of the council was sent is, one of the things is make it much easier for that to happen. So you're not stuck in this old way of working and this really bureaucratic way to even get the funding to be able to employ GPs. But for our practices around the city, that might well have be another pathway that you can get GPs in. So it wouldn't be instead of, it would be in addition to, because I think the real point there is it's not the recruitment and retention of GPs we have in the city is not going to be solved by magic bullets, but what it does need is support from the centre, from national government. And one of the things that we think would help, or certainly might well help, is that if we could employ them as a council, because also our bureaucracy within the council could support that. Whereas if you're a GP practice, the more GPs you have, the more admin you have, and all that kind of stuff. So we're a big organisation; we can absorb that within a much bigger area. Whereas especially if you're a smaller GP practice in the city, recruiting GPs and going through that process is actually quite a bureaucratic burden on what is effectively a small business. And so that could be something there. It might be that rather than us doing directly, as I'm going to come in a minute to, I think we're going to come in a minute to what we're doing next.
Yeah.
But one of the things might be is that it fundamentally, we might not say, okay, maybe us employing them directly might not be, especially if they don't change legislation, might not be the most practical solution. But there might be other things we can do as the council to support the GP practices in their recruitment as well, including the admin side.
Okay, no, thanks. There's a lot of layers to it that I don't think probably most people understand, and where it's essentially, like you say, practices are essentially a private business. It's almost like a franchise model, isn't it? Where, if you're essentially trying to carve up a bit of someone else's turf, and that sounds like a horrendous way to talk about patients, but essentially if that's how the model operates, you've got to fight against that in order to be able to do the right thing for people, which is get more GPs in front of people. So
and that is the thing, and it all goes back to 48, and it all goes back to the fact that, of course, the NHS came in and it replaced private doctors. So it was a way of placating doctors that say, well, you retain your list of patients, you will get paid per patient effectively. You'll give them the resources that will fit your list, and that effectively is the underlying situation in terms of how much your practice gets of support for to be able to do this. So that really goes right back to the fact that when healthcare was nationalised, and it fundamentally hasn't changed since then. And even with this latest NHS reorganisation, which came into statutory footing on the 1st of July, it still hasn't changed. So we're still in that fundamental model of GP provision as we've been for the last 74 years.
Crikey. So what's next then? What's kind of the next? What's next on the action list?
So on the 4th of August, so in a week and a half's time, we are going to be having a conference, which was hosted by myself and Councillor Vernon Jackson, and we are bringing together GPs, pharmacists, physios, other primary care professionals, and obviously our colleagues from the council, and from the wider integrated care system as well, which is the new body, which is the Hampshire Isle of Wight body that supports, that effectively is responsible for the NHS in our area, and really have that really open, frank conversation and say, what are the issues in terms of recruitment, but not just about that. It's also about to get across and help help the people, the GPs and people within the healthcare sector, understand the feelings of the local people in the city who are feeling like, I can't see a GP, it's really hard to get an appointment. See what their best practice is out there, because it's very noticeable that some GP surgeries are easier to get appointments than others, or certainly it feels that way. Other GP surgeries have a really poor reputation, and it feels, and the response we have from people with those is that they feel like actual barriers are put in the way of having a face-to-face appointment, that it almost seems to have entirely gone to an online first, which during the pandemic, of course, that was the preference, because obviously you wanted to keep people away from surgeries if you could. But actually, as we know, though it might not have felt like it, there was always, all GP surgeries in the city did do face-to-face appointments throughout. I know that wasn't the case everywhere, but there were face-to-face appointments throughout the pandemic. Even if some of them were very few, there was at every surgery. So, and the feeling is that some of the worst practice from the pandemic has been carried over to post-pandemic now, or not post-pandemic, but the situation we are now.
Yep.
And it's just about say, okay, how can we get a standard level of service across all our surgeries? What good practice could there be? What learning can there be? What kind of thing can we do differently? But also, what asks do we need to make of central government with the ministers? What asks do we need to make of for the integrated care system, our new NHS body who's responsible for the NHS in Hampshire, Isle of Wight? And what practically can we do together? What can we do from the council's point of view? How can we support that recruitment strategy, which they all need to do? How can we support retention? One of the really interesting things, I was talking to senior GP in the city just a couple of weeks ago, was the fact that you can you can train up GPs, and we have a really good training program at GP practices in the city, very successful one, produces lots of fantastic GPs. However, retaining at the end of their training period, very, very hard. And a lot of them are not necessarily leaving the city, but what they are doing is they're not staying in practice settings. They're becoming locums. And locums, if you're not familiar with the term, you would have come across it probably at some point. But effectively, they're your if you think of teaching, they're like your supply doctors. They're like supply teachers. You know, they fill in at practices for effectively when they need extra capacity, or doctors off sick, or not well, or not available for any reason. And because if you're a locum, you can make your own hours, you can decide what you want to work, it's not set, and also the standards model for paying locums is more expensive, and indeed we know that some practices in the city, for example, and this is becoming more common practice nationally, a way to get locums is saying, well, we'll employ you as a locum, but or even as a salary GP, but you don't ever have to do a face-to-face appointment. And again, but that's the level of desperation there is to get bums on seats, so to speak.
Get someone in the door.
Just to get someone in. So it's this real balancing act here.
There's a lot there. So no, well, thank you for coming on and talking about that, Matthew. It's really, really interesting. We look forward to if you can come back on at a later date and let us know how that meeting on the 4th goes. Perhaps after we've had our summer break. It'd be lovely to hear more from you.